The following portion of Daytime is sponsored by Orthopedic Medical Group of Tampa Bay.
The knee is the largest joint in our body, and while strong, it's also prone to many types of injuries. That's especially true for athletes. And here to discuss sports-related knee injuries is Dr. Edward Becker with Orthopedic Medical Group of Tampa Bay. Doctor, welcome. Good to have you here.
Thanks for having me.
So what are the most common types of sports-related knee injuries that you see?
The two most common types of injuries I see are injuries to ligaments around the knee and the meniscus. The ligaments hold the bony structures of the femur and the tibia together, and the most common one that I see is called an ACL tear, which is also commonly called the sports ligament of the knee. Meniscus tears are also very common. These are two structures around the outside of the knee that provide some stability and cushion to the knee joint.
What causes those injuries?
Various injuries from an athletic standpoint, and this can happen from an abrupt stop and a twisting type of injury to the knee. In non-athletic situations, can happen from a fall, trip downstairs, step off a curb. Does not need to be a highly traumatic injury.
Let's talk about treatment. Are there conservative, like non-surgical options for treating this sort of injury?
Yes, depending on the level of activity of the patient, we surely can plan the treatment algorithm based upon that. Therapy, anti-inflammatory, sometimes cortisone injections can be utilized, bracing for some instability. If not conservative, then we start talking about reconstructions and treatment options for these injuries.
So if surgery is necessary, what does that entail?
For an ACL, commonly this requires a reconstruction, meaning we recreate the ligament in the knee to provide the stability back. The meniscus, on the other hand, can sometimes be repaired. Other times we perform what's called a partial meniscectomy, meaning we remove the damaged portion of the meniscus.
And how involved are those procedures? Recovery time in surgery, things like that?
Both surgeries are arthroscopic, meaning minimally invasive. The ACL reconstruction, people are walking within several weeks. Full recovery back to sports takes several months, usually 7 to 9 months to full return to sports. For meniscus tears, partial meniscectomies are much quicker recovery. Several weeks, people are back to their full activities without restrictions.
What do you say to people who feel that they may have injured their knee, but they're like, I'm going to wait it out. I'm going to wing it. I'm not going to go see a doctor yet.
Surely, if people are having pain, swelling, especially mechanical symptoms or instability, I would recommend them getting them checked out, because sometimes injuries that are put off too long are no longer repairable.
And so will you start, I assume so, with the more conservative and then see if more treatment is needed as you go? Is that your approach?
I always try conservative management if possible. Some things, surgery is the recommended first step, but obviously if conservative options are there, we go there first.
And you have all the options available?
Yes.
Very good. Dr. Edward Becker, thank you so much.
No problem. Thank you.
Appreciate having you here. And if you'd like to learn more about Orthopedic Medical Group of Tampa Bay, you can visit their website. It's omgtb.com. Daytime, we'll be right back.
The preceding portion of Daytime was sponsored by Orthopedic Medical Group of Tampa Bay.